Now, one of our leading stories today, Health Minister Dr Aaron Motsoaledi briefed the media on the findings of an SIU probe into fraudulent claims against health departments across the country. Minister Motsoaledi joins us now in studio for more insights. Minister, thank you so much for your time and thank you for joining us.
Thank you very much, Katleo. Thank you to the viewers and listeners out there.
No, it's an absolute pleasure. First of all, congratulations on the success of saving 3 billion rands, of course, through the collaboration between the department as well as the SIU. But some harrowing accounts that you stated in that probe from practitioners claiming for children that were not alive, others going against the advice of medical experts with cases not of negligence by the Department of Health within the provinces. What do you believe within the health department system led to some of the fertile ground that was created for legal practitioners to abuse the system in the way that they have?
Well, I think the main problem really is the manner in which the legal system in South Africa allows this form of compensation. Look, everywhere in the world, adverse events happen in hospitals. It's something that, as long as this healthcare system will live with. But of course, there are areas of negligence, malpractice, unethical practices, etc. So people need to be compensated. Now, the problem is that in South Africa, the compensation system induces perverse incentives. In that, for instance, lawyers don't get paid by the clients. They don't have to. Like when you go to a lawyer, you must pay them a certain amount to represent you. In this case of medical legal claims, they don't get paid by the clients, but they get what is called contingency fee, whereby whatever they claim in court, they are entitled to 25% of it. Meaning if in court the litigation is for 10 million, and if they get it, that lawyer is going to get 2.5 million. But most of the time, they even take more than the 25% because the clients don't know. So that makes the lawyer chase the money and see the prospects of being rich just through one claim, that I may actually become a millionaire just by making this one claim. And that prospect of chasing to be a millionaire is what led to this type of things. But of course, added to that is our own systems, whereby, for instance, we don't yet have an electronic record-keeping system in hospitals. It's still manual. And you heard today that they just put in a false claim and make sure that the file is stolen. And once the file is stolen, the healthcare system, the hospital can't prove anything, even where the lawyer is not telling the truth. Whatever he claims, the judge is going to provide, because there are no files. So there is a syndicate to steal the files, so that you can't prove that this activity they are claiming actually never happened.
I mean, you also speak of, in some instances, where the lawyers are not even giving some of these millions to children that are deserving and where it should be working, especially in the areas where children don't even have ramps for them to be able to use the wheelchairs in the cases of cerebral palsy. What would you outline as the key findings and outcomes that stood out for you the most, that led to some of these significant savings?
Yeah. You know, stealing from the state is one thing, but stealing from a disabled child, that now goes beyond the realms of, I don't know how to describe it. It's much more painful because we've got lawyers who did that from this report of SIU. Like in the Northern Cape, a lawyer who was paid, claimed 18.7 million, right? But decided to give the client 6,000 rand every month.
Sure.
And he has been doing so for 18 months before the SIU caught him. Meaning he was going to continue like that. In 1 year, he will have paid 72,000 rand. And only after 15 years, the amount will have reached 1 million. Meanwhile, he's keeping 18.7 million in his own trust account. Remember, part of the problem in the system, that's the legal system, is not us in health, is that when you have litigated, the money is not given to the clients directly. It's paid into the
lawyers.
Trust account of the lawyer. the lawyer must then open, the courts usually instruct them to open the trust account for the individual patient and deposit the money there. But that's not what they were doing. That's why I'm saying it's stealing from the poor. Then you have got the situation in Eastern Cape where gogos, very old gogos who are taking care of children on behalf of their daughters, are duped and tricked into signing a power of attorney to allow the lawyer to sue. Whereas when they went to the gogo, they say, look, we are from SASSA, sign here for the child to get child support grant. The poor gogo signs, believing child support grant is coming. Meanwhile, they are going to sue the state for millions. And obviously, because this gogo is not expecting millions, if they give an amount of money equivalent to child support grant, which they've promised, she's happy. She's satisfied.
Sure. But are there ways in which we can educate the public for them not to be used by these legal practitioners in the way that they have?
What do you do? By educating the public was, as I said, Katleo, the lawyers trick the gogo to sign the power of attorney. She's not aware of any lawyer. She believes she's signing SASSA documents, which are legitimate, if you understand what I mean. Then there are situations where patients told the SIU that I've never been to that hospital you're talking about. I've never been there. But yet the lawyer is suing on their behalf for that particular hospital. Or a situation where the child is long deceased, but the lawyer submitted a claim, among which he's claiming for future medical care based on private health care rates, that this child is going to go to private health care for future medical care because of this disability induced in the hospital. And, but the person is long gone. And then they even put a claim for loss of amenities of life, that you can't enjoy amenities of life because of disability. Meanwhile, you are gone. You're no longer in this world. They also claim for future earnings. You know, so that's grossly unethical. That's why we are not only reporting them to NPA for criminal prosecution, but also to the Legal Practice Council, so that they must be taken to DC for professional misconduct. If possible, be struck off the roll.
And you have called for those that know that they've put out fraudulent claims to come out within the next 2 weeks. What would be the incentive for those that come forth before they are found in these investigations?
Because if they come forth, nothing will happen to them. There will no longer be investigation. It will be the end of the story because there's nothing to investigate since they've withdrawn. Actually, when the SIU went into Eastern Cape, quite a number of lawyers came to withdraw when they heard that there's some form of investigation. So we are not talking about something that did not happen before. We are just giving them an offer. Like in Harrowing, they've put in 2,450 claims, and the SIU has only investigated 116. When are they going to arrive at 2,000? So we're just saying, please relieve us by taking away these false claims, so that the SIU doesn't have to investigate anything and nothing will happen to you. But if you don't withdraw, the SIU will come in and the penalties will be huge. So in order to save their profession, it will be better to withdraw.
So, Minister, in the interest of some of our viewers, this saving of 3 billion rands, what impact would this have on the department?
Put it the other way, if the department was forced to pay the 3 billion,
yes,
the various provinces, it of course reduced their budget. 3 billion rand is a lot of money. You can do lots of things. Or put again alternatively, in Harrowing, they've submitted 2,450 claims worth 24 billion. Imagine if we were forced to pay that amount of money. In KZN, it's actually 29 billion. If you were forced to pay that amount of money, it means the whole budget collapses. So when you have saved 3 billion, it's actually important because it's on few cases. Imagine if they were to do more and more and more cases. How much saving will there be in the healthcare system?
So, Minister, in light of this successful outcome, what preventative measures is the department now looking to put forward in ensuring that these occurrences don't happen going forward?
Well, we did have a summit in 2015, a medico-legal summit where we called together public, private, legal experts, etc., to look into this issue. And they arrived at 3 solutions. The first one is patient safety, that in order to reduce the incidences of adverse reactions, because adverse reactions do occur, can we find a way so that they are reduced, even negligence for that matter? Then the second one is administrative solution, where hospitals must make sure that their files, it's not easy to steal their files. The only unfortunate thing is some of the people who are involved in stealing the files are nurses in the same hospital who are working with the files, but submitting them illegally to their lawyers.
And some of the nurses that we interviewed earlier on saying you're pushing the blame onto them. It's not necessarily them that are stealing these files.
It's not me, it's SIU. Why do they say I'm blaming them? Did they tell you that?
That's what they said in the interviews.
It's an SIU finding. What should I say about it? I did not even know that nurses are stealing files. SIU found some of them. So what should I say? It's an investigation. You know, why do they say we're shifting the blame on them? I'm just stating the facts of the findings. If they challenge these findings, they must do so because the SIU is going to report them to NPA to charge them. That's where then they'll give that reasons that we are scapegoating or blaming them. It's a finding by the Special Investigating Unit. And of course, the last solution will be legal, whether we can mediate going to court. But to me, the final solution is to change this perverse incentive of compensation. Because in many advanced economies, like in Europe, in Scandinavian countries, as an example, this doesn't happen. But what happens if maybe you are injured in a hospital? They've got a special tribunal formed of retired judges, senior counsel, retired professors of medicine, retired senior nurses, social workers, who sit and say, look, this person is on a wheelchair because of the injury they experienced in hospital. What is a fair compensation for this person? So they determine fair compensation instead of rushing to the courts where this type of perverse incentives will come.
Right. So, I mean, looking into some of those, Health Minister, some of the claims that have already happened have been paid out. Is there a possibility of some that would be found to have been fraudulent to retrieve that money back?
Some of them have already charged the money. That's why there is a fund specially established where lawyers pay the money into it, which is a form of insurance. It will pay these patients so that they don't lose out. But as to the lawyer bringing back the money, that will be determined by NPA when they start charging them. And I'm very much interested about these nurses. I never named any nurse, I just said nurses. Why are they saying we are scapegoating on them? Because they don't even know which one of their colleagues stole the funds, the files, or do they know something that we don't know? It's a very funny thing. The nurses who you interviewed should have said, I don't know anything about it, rather than say you are scapegoating when the SIU actually made the finding and even know the names of the nurses who did it.
But what would you say, Minister, are some of the lessons learned out of this experience? What can we take as a country, as a department? And I mean, there are other ongoing investigations that there are collaborations with the SIU and the department where you're going to find other findings of fraudulent activity where you would be able to save money. What are the biggest lessons that we need to take out of this?
Well, the biggest lessons is, first of all, we need to have laws that made it impossible to go and steal this money, especially from patients of the state. At the moment, I'm saying the laws that is there encourages these perverse incentives. I think that's the main issue. But the second thing is to have systems like electronic record systems in the hospital so that stealing a manual file doesn't become possible. But also the issue of ethics, just the ethics of it all. Here is a child who is disabled and you freely steal money from that child. That's actually shocking.
Sure. I know a lot of the times when you get interviewed, Minister, NHI will always pop up regardless of what it is. And maybe just marrying the principles of the success of this particular probe. What are some of the lessons there that you would say in terms of enhancing oversight, rooting out corruption, and just optimizing on resource allocation would be able to strengthen the implementation of NHI?
Yes, we said so that we are now partnering with SIU. Actually, SIU has established an anti-corruption forum, which involves public, private, SIU, and other law enforcement agencies. And our message is corruption won't be tolerated, whether it's in medical legal, whether it's in NHI or any other system, because corruption and development cannot be found in the same sentence. When there's corruption, the country won't develop. So there's no way we should ever tolerate it. And we'll ask members of the public to whistleblow as much as they can. You know, before I left Home Affairs, 2 weeks before the elections, you'll remember, Katlego, that the SIU and us went to raid the refugee reception centers. Yes. And I already know some of the preliminary results they showed me. They are shocking, you know, of what people there were doing in terms of corruption. How did we go there? A whistleblower tipped us and say, I'm working here, this is what people are doing. So it's important that as South Africans take that job of tipping us, because they are saving the country, their own country, and of course themselves, because with this corruption, every citizen becomes a victim.
And it's very important that you mentioned that. I mean, even Saftu Zwelenzima Vavi mentions active citizenry and how citizens should be at the forefront in ensuring that corruption is curbed. Do you find that there's a disconnect, though, Minister, between the citizens, the government, the administrators that would be, and I mean, it's a few rotten apples that would be at the forefront of such criminal activities?
I wouldn't say so, because to tell you the truth, in Home Affairs, we had a lot of whistleblowers. I know on the media, especially yesterday with the commemoration of the terrible death of Babita Deokaran. I know people were very angry that the state that they will never whistleblow, the state doesn't protect whistleblowers. I was listening to them. I said, they don't know how many tips we got from Home Affairs every single day. People come in with large numbers, especially after we disclosed that Pastor Bushiri, the so-called prophet, got his documents in Home Affairs illegally and fraudulently. From there, people came forward and said, no, look this way, look that way. Now, in health, we're also calling for the same thing. If you know that your colleague is involved in syndicate inside the hospital to steal files and give them to lawyers, please come and tip us. You know, they don't just steal the files and stop there. After having the file, they apply for the same files through PAIA. Provision of...
information.
Provision of Access to Information Act. You apply for this file because you are entitled to it via PAIA. But you know that you have stolen it and it's not got forthcoming. And when it's not coming, they then charge the hospital that they were not able to bring the file, and they rush to court to make the medical legal claim of things that did not happen, simply because the file is not there to prove what actually happened. So it's just perverse incentive after another. And there's no way we can allow the country to go in that direction.
No, most certainly. Minister, thank you so much for your time, especially so late in the evening. We certainly do appreciate, and we hope that with further investigations, there'll be more savings, especially within the Department of Health.
Oh, definitely, there are going to be. There's no question about it. If we can save 3 billion just having started with a few cases, you can imagine when most... I told you that in Gauteng is 2,450 cases, and SIU is just busy with 616. They've just completed about 58. And when you go at all the provinces, already 3 billion that has been saved. So we are very confident that huge amounts of money are going to be saved.
We certainly do hope those legal practitioners will come forward and save you the time as well, and some of those nurses and their files.
Yes.
Thank you so
bring
much,
them
Minister.
back.
And bring those files back.
Thank you.
That was Health Minister Dr. Aaron Motsoaledi.